Tonight on CBC Vancouver News.
This is a very challenging time for us. It's hard to know how things are going to go.
Another death and more than 50 new cases of COVID-19 in BC. Also,
at least this will provide some warmth, some play, some joy when they come and see a smiling face with one of those masks on.
what BC health officials are saying about the widespread use of masks. And
for a while there, I honestly felt like I was really neglecting the kids because he was my number one priority.
Trying to keep their boys healthy.
Here you go.
When both parents have COVID-19.
This is CBC Vancouver News.
Good evening. BC has dozens more confirmed cases of COVID-19 tonight, and our health minister is taking a hard line with returning travelers. They must, he says, self-isolate, no exceptions. The CBC's Dan Burrett joins us live with more from the provincial update today. Dan.
Mike, 53 new confirmed cases of COVID-19 are in BC, and we have one more death. We've now lost 25 people. We have 1,066 confirmed cases in our province now. Of those, 606 have recovered. Just a short time ago, TransLink announced that 2 transit workers have tested positive. One is a bus driver in Port Coquitlam. The other works at the Burnaby Transit Centre. Now, to try to keep our numbers from going up, as you said, Health Minister Adrian Dix is taking a tough stand on people returning to BC from abroad. He says they must self-isolate for 14 days. No ifs, ands, or buts. We know Canadians across the globe have been trying to get home, some stuck in countries where lockdowns are in place, like India. Others are on cruise ships.
It would be, I think, a real betrayal of the people in your community to not follow those rules, which are, by the way, also the law at the federal level and the order at the provincial level. And that's our responsibility. And everyone who comes home, everybody who comes home has to understand that and to follow those rules.
Now, here in BC, Dr. Bonnie Henry says more long-term care homes are being affected by coronavirus. 21 homes now have outbreaks, but most are small, and the threshold for declaring outbreaks there is low. Fraser Health says a resident at the Swedish assisted living residence in Burnaby and 2 people at Chartwell Cedarbrook retirement residence in Mission have been diagnosed. Henry says the more people are committed now to physical distancing and avoiding groups, the less everyone outside the healthcare system will have to do later. And she's encouraged by the social connections people are making, even as they stay physically apart.
People leaving flowers and groceries on the doorstep for their neighbors, and how appreciated that is. We've been seeing young children having virtual kindergarten and virtual play dates, and I know more of the virtual teaching and learning will be happening in the coming days.
Meanwhile, visits to hospital emergency rooms in our province are way down. Adrian Dix says on March 9th, ERs in BC saw more than 6,500 visits. On March 30th, about 3 weeks later, that number had dropped to 3,200. Mike.
Some encouraging numbers there. All right, Dan, thanks. Dan Burrett reporting live tonight. Well, a BC family is facing a COVID-19 crisis that more of us could be dealing with in the weeks ahead. The mother and father have both come down with the virus, and they are trying to prevent their 2 teenage boys from catching it, while all are confined to their Kamloops home. Eric Rankin of our CBC Vancouver Impact team has that story.
Take you for a tour and I'll show you where Lane lives.
It might not be unusual for teenagers to seal themselves in their rooms.
Right there. That's where he is.
But in the Elliott household, this is their new normal. Mom and Dad caught COVID. No one knows how.
I've been trying to bottle up my emotions for a number of days now, and for a while there, I honestly felt like I was really neglecting the kids because he was my number one priority.
He is 48-year-old Keith, hit first and hardest, just back from the intensive care unit in Royal Inland Hospital, still recovering from burning lungs, fever, and days on oxygen.
Here you go.
I'll try and fold laundry or something, but I'm not overly useful, truthfully.
46-year-old Dana developed COVID before Keith got home. Not as severe, but in a haze, she struggled to make sure their 2 sons, 13-year-old Ryder and 15-year-old Lane, didn't catch it too.
I'm a very physical person. I like to touch my kids. I like to hug them. So that's been a hard thing for me.
Now back together, Dana makes separate meals to try to stop the spread. Both teens eat microwave dinners and keep to their rooms. The uninfected and infected but recovering, self-isolating under one roof.
The older one, he's feeling a little bit more like a caged animal.
But the teens know their mom and dad are doing their best.
I'm thankful that my parents are still taking care of me, even for all this.
On today's show, Dr. Brian Goldman is the host of CBC Radio's White Coat Black Art and an ER physician.
This is a terribly impossible situation, and it's real life. And as we have more community spread, we're going to see more and more families just like that.
Goldman says the Elliots are doing a good job, but in addition to gloves, he recommends wearing masks. Dana, herself a hospital pharmacy technician, also has some advice.
Just be aware that it's such a contagious virus and you can get it anywhere, so be safe.
Eric Rankin, CBC News, Vancouver.
And there is new financial relief on the way for BC Hydro customers, residential, commercial, and industrial. Our Tanya Fletcher is live with more on today's announcement. And Tanya, break it down for us. Who's going to be saving what?
Yeah, Mike, help is coming for homeowners and renters, as well as small businesses and major industries as well, like pulp mills and paper mills and mines affected by the pandemic. So here's a look. Affected residents will be eligible for a 3-month credit. They'll receive this bill credit of 3 times their average monthly hydro bill. Small businesses can have 3 months of hydro bills forgiven as well. It's called a payment holiday. This can apply from April to June, and no repayment is required there either. And major industries can defer 50% of their payments for 3 months. So again, this is mines, pulp, paper mills. They can put off their hydro bill payments on that front. Now, the savings for homeowners and renters are expected to add up to $477 for the average customer. And it's for residential customers who've lost their jobs or are unable to work as a result of COVID-19. They will have to provide proof of job loss, and they can apply for that bill credit starting next week. Premier John Horgan today emphasized that it does not have to be repaid, but he appealed to people to only take advantage of this offer if they have to.
Mr. Ralston and the government and BC Hydro have been working on trying to bring forward policy proposals that will reduce costs for people right now. And that means ensuring, of course, that we do our level best to apply for these programs only if we need them, so that there is more resources available for those who desperately need them.
Now, applications for small businesses will open up the week of April 14th. The total price tag, by the way, for all of this hydro relief is pegged at around $90 million. And this, of course, is on top of the BC Hydro Customer Crisis Fund. That offers a grant, kind of a one-time grant of up to $600 for residential customers. And we should mention as well, today BC Hydro announced an across-the-board 1% rate cut for all customers. Mike?
So even if you don't apply for that extra credit, as it is, everybody will be entitled to that 1%.
Exactly. Yeah, that's kind of, it was actually an aside to what was announced today. It was the BCUC had applied for that even before this hit. So they announced it today, but it's across the board for everybody, all industries, that 1% rate cut.
All right, very good. Thanks very much. Tanya Fletcher reporting for us live tonight. Now, suspected overdose deaths are rising during the pandemic. In Vancouver, they reached a peak in March that hasn't been seen in more than half a year. The city says there were 8 suspected overdose deaths between March 23rd and 29th, the highest weekly total since August. It is urging drug users to continue using at supervised consumption and overdose prevention sites. Well, if you're heading out of the house for groceries, you may be wondering whether you need to wear a mask. It has been a subject of considerable debate and discussion. Countries like Austria and China want all their citizens to wear them. Mickey Cowan tells us why that's not the case here in BC.
Staff at the Union Gospel Mission serve some of the city's most vulnerable every day. Now they're doing it wearing brightly colored, hand-sewn face masks.
At least this will provide some warmth, some play, some joy.
The mask force, as he calls it, have made hundreds in the hopes of protecting the homeless people they serve.
They're the most at risk. We need to take whatever steps we can.
Provincial health officials aren't against people wearing the masks, but they aren't recommending it either.
We need to be a little bit careful. You know, they're not a medical mask, but they can keep your droplets in when you're out and about with others.
So if you're sick, there could be a mild benefit to those around you. But for the average healthy person, there's little evidence wearing masks in public helps.
What is not proven is that they provide you any protection.
Worldwide, the mask question is under debate. The World Health Organization says you don't need to wear a mask unless you're taking care of a sick person or coughing or sneezing. Individual countries are taking different approaches. Austria has made wearing masks compulsory, and China recommends it.
The jury's out on whether they have a small benefit rather than no benefit. The small benefit is still useful.
But here in BC, the bigger concern is supply. The advice from the top is don't wear disposable masks unless you are sick or caring for the sick.
The supply of medical masks and respirators is tenuous, and it needs to be reserved for our healthcare workers and for those who care for people with COVID-19 and other patients.
Healthcare workers in BC are in direct contact with patients. They do need to wear masks and other personal protection equipment. The province is asking people with face masks to consider donating them instead of wearing them and focus on what is proven to keep people safe, keeping a physical distance from others and washing your hands. Mickey Cowan, CBC News, Vancouver.
You may recall just last week, Prime Minister Justin Trudeau gave public assurances that federal stockpiles of protective equipment like masks were sufficient. But there are now warnings about problems in our supply chain. David Cochrane has the leaders who today laid out some cold, hard facts.
The federal government came into this crisis with an emergency stockpile of supplies and a big unanswered question. Will it be enough?
No, we likely did not have enough. I think federal governments for decades have been underfunding things like public health preparedness. And I would say that obviously governments all across the world are in the same exact situation.
In the exact situation, and now all trying to buy the exact same things. There's a global run on the masks and gloves that every health worker needs. Supplies are being rationed in Canadian hospitals and are becoming increasingly hard to get on the market, even when you think you have a deal.
There is a whole saga behind the scenes of inventory that doesn't exist, of orders that disappear, and quite frankly, of deliveries being purchased from underneath us at the plane by other jurisdictions outside of Canada.
Those market conditions emerge as some provinces scramble. Hard-hit Quebec has burned through a year of supplies in a single month, showing just what the country is up against.
Health systems were never designed for this kind of surge, and so that is the challenge.
This is precisely why the government has signed deals with companies to make these supplies here in Canada. That global competition will only increase, and it's becoming more and more difficult to rely on other countries for help. David Cochrane, CBC News, Ottawa.
Well, whether it's medical supplies or other products, the COVID pandemic is proving a challenge for those tasked with getting essential supplies to our communities right across the province. Many traditional rest stops have been closed along BC trucking routes. As CBC Vancouver Impact Team's Belpuri reports, access to food and restrooms has become difficult for long-haul drivers.
The past few weeks have been a tough journey for long-haul drivers.
A lot of the 24-hour restaurants and 24-hour facilities that we would generally stop at or have access to with such a large vehicle are restricting their hours and restricting their staff.
Coronavirus closures and efforts to physically distance means few places for food and even fewer bathrooms.
A lot of customers and a lot of shippers and receivers don't necessarily want you in their buildings, right?
The Truckers Association has been working with restaurants along major routes to open their bathrooms to truck drivers and to provide online meal orders via an app. By the weekend, it hopes to have food trucks in key locations.
We've got a couple in the interior, one in the Kamloops area. We're hoping one in Vernon, and then also one in the Chilliwack cardlock facilities as well out in the Fraser Valley.
A social media push will advertise the facilities. The issue of safe, clean washrooms for truckers has been brought to the attention of the provincial government. A spokesperson with the Ministry of Transportation says it's exploring ways to provide more facilities for commercial drivers across the province. In the meantime, it's installed portable washrooms at vehicle inspection stations on the Lower Mainland. And a Vancouver Island town has taken matters into its own hands. A Sydney parking lot is now a rest stop for truckers. It's close to amenities and can handle up to a dozen big rigs.
Some porta potties and some staff time to obviously maintain that, have some signs made, and a little bit of advertising, but that's a small price to pay to make sure that our supply chain's maintained, and we're happy to help.
Drivers can park overnight. With usual pit stops closed, it's one way to remedy the lack of places to rest, eat and clean up, so long-haul drivers can keep on trucking. Belle Puri, CBC News, Vancouver.
Pollution levels over the South Coast are plummeting as physical distancing measures keep people indoors and cars off the roads. Nitrogen dioxide is created when cars burn gas, and this satellite image shared with CBC News shows levels of it in the air in March of last year. This is how things looked in March of this year. Major cities like Toronto, Edmonton, and Calgary are also seeing declines. Well, artists are honoring the health officials leading this province and our country against COVID-19 with murals painted on the boarded-up windows of a business closed during the outbreak. The owner of Kim Prints in Gastown asked local artists to use the space to celebrate BC Provincial Health Officer Dr. Bonnie Henry and Canada's Chief Public Health Officer Dr. Theresa Tam.
They're leaders. I mean, here they are. You hardly ever saw them in the news before, and now every day you see both of them in the news telling us what to do, how to guide us. Everyone stops to take pictures. They love it because it's better than seeing the brown board. They just want some connection, but at a distance.
Artists added a tribute to healthcare workers to the mural today, and there are plans to expand it even further. Meteorologist Brett Soderholm joins us now with the forecast. A little bit of everything going on out there today.
You got that right. I mean, yesterday we had a thunderstorm. This morning, people woke up to some snow on the ground and even some remaining hail from yesterday's storm. And then it's been cold and now it's sunny outside. It's like the weather can't really make up its mind. And guess what? It's going to be like this all the way into tomorrow and really the end of the week. So I want to walk you through what you can be expecting, showing you a few of my maps here. First and foremost, when it comes to the lower mainland, the precipitation that we're expecting to see could fall as snow tomorrow morning, especially into the Fraser Valley. So we're talking about anywhere between 7 and 9 o'clock in the morning. Temperatures will be right around the freezing mark, so that means some areas may see a bit of a rain-snow mix. And then as we go on throughout the day, that's just going to be some spotty showers here and there. Now, in other places across BC, the story is going to be one, I guess, a little bit more of snow, especially into the Kootenays. Wanting to be mentioning that places like Cranbrook and even Nelson, again, could see a little bit of flurries. And the same thing goes when you look at areas, say, like Whistler and Pemberton. We'd be seeing a little bit of flurry activity there, but farther to the north, it's still just very cold and very clear skies. So I guess that is a trade-off if you do enjoy those conditions. On the note of temperatures, do really just want to mention that again, overnight lows tonight could be going down to anywhere that is 10 to 15 degrees below normal for this time of year. Looking at Kamloops there, that is minus 13 potentially tonight. And as I mentioned earlier, Vancouver as well going down to the freezing mark. Now for a 5-day forecast here in Vancouver, we are in April, but we are still going to be dealing with a little bit of that snow, as I mentioned. So for both tomorrow and Friday, as far as the forecast is concerned, could be starting the day with a little bit of flurries. The sun might come out a bit later, and then it's not going to be really until the weekend and into next week when our temperatures are going to start to go back to normal.
All right, Brett, still pretty chilly in the evening. Thanks very much. Well, seniors locked down in a Summerland care home have been getting musical performances on the other side of the glass. The singing and ukulele stylings of Liam Calderbrink there. The Summerland Seniors Village called out for musical volunteers to play for their residents from a safe distance, and Liam took up the challenge. He said he had 3 classic tunes up his sleeve, but was preparing more for another time, and said it is much for the care workers as it is for the residents of that Summerland home. Way to go, Liam. Nice job. Just a very quick reminder for local news anytime. We are at cbc.ca/BC. All right, coming up next, more COVID-19 coverage along with news from right across the country and around the world as we join the National. My co-host Anita Bath will have more BC news at 10 o'clock tonight. Stay right here. More news coming up next.